Hey guys, Julie here with Birmingham Mom Collective, and today we are talking all about oral surgery for adolescents and teens with Dr. Morlandt from the Oral Surgery Clinic at UAB Medicine. How are you, Dr. Morlandt?
I'm great. Good to see you, Julie. Thanks for
Good to
having
see
me.
you. Thanks for coming on. All right, we're going to dive right in here to these questions. So tell me about the services offered at the OMS Inverness Clinic and what surgeries and services that you do at the practice.
Well, thanks for asking. It's a fairly new clinic. It's been open about 2 years, right on Highway 280 across from the Aldi and the Full Moon. I think most people know One Inverness Parkway. Yeah. Red roof on the building, real easy to see. And UAB is well known, like many huge academic medical centers. We're well known for complex things, heart transplants and brain surgeries and complex cancer surgery. And over the years, I've been here 12 years, I've heard from friends and neighbors and people in the community that sometimes to get a patient in for a relatively simpler or a less invasive procedure can be difficult. And so we've really tried in oral surgery, but across UAB in general, tried to access the community, tried to make ourselves available so patients can come in and get, really, really good care in a safe environment. And so that's what this clinic is designed to do. We don't do we're not doing cancer surgery at this clinic. We're not doing complex TMJ surgery. We're doing the things that most patients need, which is, to answer your question,
Yeah.
wisdom teeth removal is the most common thing we do. These are patients referred from an orthodontist or a dentist. Usually these are adolescents, anywhere from the ages of 14 to about 26 is the ideal time to remove wisdom teeth. And sometimes it varies with that. Sometimes we'll see children referred from an orthodontist with a canine tooth, an eye tooth impacted in the jaw, buried in the jaw, that we then need to expose and bring that out. And everything we do is offered with IV sedation. So we're doing this with anesthesia, so the patient is comfortable yet completely safe, connected to all of our monitors, and monitored not only by an operator anesthetist, a surgeon who's controlling the delivery of the surgical care in the mouth and the anesthesia, but UAB, we have nurses, we have highly trained individuals, we have lots of support, so it's a very safe operation. But so the most common procedures, to answer your question, are wisdom teeth, removal and exposure of impacted teeth, and then for adults, we do a lot of dental implants. So that means we've lost a tooth from gum disease or a cavity from caries. A root canal may not save that tooth. The tooth may need to be removed. And then we have ways of replacing either individual teeth or all the teeth if someone comes in and has no teeth. So those are the most common things we do there.
Okay, great. All right, so we talked about the most common procedures you perform. So we're going to talk about these wisdom teeth because that's what a lot of moms are helping their kids with for sure, and probably some removal of teeth as well. So what's the typical recovery time for the common surgeries like wisdom teeth removal or maybe an impacted tooth removal?
Great question. The wisdom teeth uh, are generally removed as a set of four, and we most often see them impacted. We see them where they're in the jawbone and have no way to come out and be useful in the mouth. So they get cysts and tumors and decay around them and gum disease. They can damage the teeth in front of them, all sorts of problems. So the recovery time, the procedure like that is a fairly efficient procedure. We can usually take all of the wisdom teeth out in a half hour, sometimes a little bit less,
Wow.
if they're uncomplicated. We would expect that patient then to go home and recover with sort of minimal activity for the next 24 to 48 hours. We say that's a great time to catch up on your Netflix, catch up on your series you haven't watched. And in that time, it's a soft diet, ice packs to the face, and then we switch that to warm compresses, usually at about that 2 to 3 day mark. And then after that, it's a slow decrease in facial swelling and a slow increase in mouth opening and chewing that usually lasts about a week. So most of our patients, if I take a child's wisdom teeth out on Friday, they usually stay home from school, obviously stay home for the weekend, stay home from school Monday, maybe Tuesday, and back to school by Wednesday. It's a little bit different for everyone, but kids in general heal wonderfully. If I take out wisdom teeth on someone my age, it's a lot longer recovery and more difficult. So there's a benefit for that.
Yeah, and as we're heading into these fall break times and Thanksgiving and Christmas, I know a lot of moms are trying to get those scheduled. here as we're coming up on those breaks. That way they don't have to miss school. So a lot of moms are worried about anesthesia. So talk about how you make that a safe process.
Oh, it's a great question. It's one of the most important things, if not the most important thing we're doing during the office procedure. And so our national organization, AAOMS, really takes anesthesia safety seriously, and to the point that it's required that every oral and maxillofacial surgeon spends at least 6 months doing anesthesia training in their residency. And the only physician or dentist who does as much are anesthesiologists. That's their entire training. So on the training side, we take the training very seriously. In the delivery of care, in this clinic, for example, every patient is connected to an EKG, an end-tidal CO2 monitor, so we can detect not only if the patient's breathing in, but that they're also breathing out. We connect the patient to a pulse oximeter. Heart rate is monitored. So all of this is done in real time, connected to monitors right there in the room. And that allows us to deliver care very safely. Our goal is not for the patient to be completely asleep like they'd be in the operating room, but to be so comfortable and so sedated that we finish the procedure without them having recall or without having really any memory of it. But during that procedure, they're breathing on their own. They respond to our verbal commands. If we ask them to open their mouth or turn their head, they can usually still be aware enough to do that, but not have recollection of the procedure. So it's an art, it's a science, but it's something we take very seriously in terms of safety. And we have this entire UAB enterprise behind us to deliver safe care. So, we major academic medical centers, like I said, are really good at complex care like heart transplants. And there's a lot of that filters over into clinics like ours at Inverness, where we still are delivering very highly effective, safe care because we have a lot of the same people and a lot of the same systems in place. So that's, I guess that's it in a nutshell. That as oral surgeons, as dentists, we can deliver really top quality care by having all those safety measures in place.
Wow, that's great to hear. We're so thankful that UAB is here in Birmingham, where we are for sure. All right, so if someone out there today is thinking they'd like to make an appointment at the office, how would they go about doing that?
Best way to do it is to call our number, that's easy to get to. No problems with that. We have an email address. Most patients are only going to know they need their wisdom teeth removed, or if it's a child, know your kid's teeth need to be removed by talking with their dentist. That's usually a pediatric dentist, can be a general dentist, or an orthodontist. Now, we have tried, Julie, to really serve the UAB family. We've got a huge employment group here, 24,000 plus employees. So if anybody is a UAB badge holder, you get an automatic discount right off the top. And that's our way of saying thanks to the community. If you work here, or if your first order family work here, like your children, we want to take care of you. So give us a call. We'll make accommodations to get anybody in. And if your dentist hasn't heard of us, we'd be happy to meet with them and let them know as well, because we really do want the dentists in the community to know we're happy to see their patients too, even if they come to us with more of the routine cases. We're more than happy to take care of them.
Awesome. That's great to hear. Well, thank you so much for your time today, Dr. Morlandt. And thank you guys for watching. We hope you've learned a lot. I know I have. And we'll see y'all next time. Thanks so much. Bye-bye.
Bye.